Comes to breast cancer, you've probably heard of the BRCA gene. It greatly increases your risk of getting breast or ovarian cancer. But recently, genetics research has advanced significantly, and Cleveland Clinic is on the cutting edge.
Genetics has tremendously, exponentially increased in knowledge.
Dr. Karis Eng is one of only 4 clinical cancer geneticists formally trained here in the U.S.
We have the only training program in the country here at the Cleveland Clinic.
And she is helping to lead the charge when it comes to potentially life-saving discoveries about breast cancer.
Many years ago, we only thought that this was BRCA1 and 2. Actually, there are at least 10 genes like BRCA1 and 2, which when altered, predisposes to breast cancer at a much earlier age than the average of 55.
Dr. Eng says many of those genes have been discovered right here in this lab. And studying them means doctors can choose or create therapies specifically targeted to the gene alterations responsible for breast cancer.
With the targeted therapy, the hope is, and this is true, that the drug goes right like a smart bomb right to the genetic alteration of the cancer. And we're using this every day, both the inherited gene knowledge as well as the breast cancer gene knowledge.
And it's not just breast cancer. Because of this genetics research, doctors know which specific organs to screen for other cancers and when.
We can actually precisely tailor when to start screening so that there's early detection and cure, and in certain cases, prevention.
Dr. Eng, by the way, part of a new study just published this week. Her team discovered bacteria in breast cancer that is not present in normal breast tissue. This is a big deal because doctors always thought cancers were sterile. And because of this, they're now looking into new treatments for breast cancer, including possibly probiotics.